everyone. Welcome to the Holistic Birth Podcast, where we put the power in families' hands to have the safe, satisfying journey they deserve. My name is Allison.
And I'm Brigitte. We are two doulas who love bringing information along with inspiration to help you feel confident and powerful in your choices throughout the birthing year.
We cover all topics around pregnancy, birth, and beyond. We're so glad you're here.
Let's dive into this week's episode. All right, welcome back to the Holistic Birth Podcast. This is episode number 2, and today we're going to be talking about informed choice, also known as informed consent or informed refusal. And we're going to be going over what that means and different scenarios that may come up to go over that. Yeah.
Oh, juicy topic.
Yes.
So what is informed choice? Informed choice means that the communication between you, your provider, your birth team kind of results in that ultimate understanding of all your options, all the benefits, the risks, and being able to then have that respected is also a piece of it. But a really good tool that a lot of times we use as doulas, it could be applied really to any decision you have to make, but informed choice is usually, you're not sometimes sure about what questions to ask, and so this tool can be really good. It's called the B.R.A.I.N acronym. So anytime you're faced with a decision or whatever, you can just kind of ask these questions, and usually it gives you a good baseline of some of the information that would help you with your decision. So the B.R.A.I.N acronym, the B is what are the benefits? Why would we want to do this thing? What would the results be? Also, like, how likely are those? That can be a good question to ask. The R, what are the risks? Are there any cons to doing this? And if so, what is the likelihood of that? And then the A is, are there any alternatives? Do we have any other choices right now? Okay, you're offering Pitocin to augment labor. Could I do, nipple stimulation instead, or do something else to promote oxytocin, or, red raspberry leaf tea? Like, is there anything else that could be done? So alternatives. The I is usually a big factor is your intuition. What is your gut saying about this choice or this thing that's being presented to you?
Yeah, very important.
So important. Yeah. And usually if you're hearing an option as you're gathering these, details about the choice, you usually have some sort of gut reaction. There's usually something that's kind of already making you lean towards or away from this choice. So like checking in with that is good too. The N is what if you do nothing and wait? Could this be reevaluated in an hour, a day, a week, a month? And is it emergent? Because sometimes we are quick to make a decision or feel like we have to, and then the problem or whatever it is might resolve, or maybe with the alternative options that we have on the table, we don't need to proceed with even exploring this choice anymore. So kind of getting that space, if you want to add S to the end and make it brains, then
brains.
That's great too, because that you always need space when you're trying to make a decision, instead of having everyone kind of just, you might feel like there's some pressure when people are kind of watching you, and especially if you have a partner or doula that you're trying to work with to try to figure out what might be the best thing for you, to talk everything out. It's nice to just get space. Most of the time it's appropriate to ask for space. If you're in a hospital, you can say, we'll ring for you when we're ready, or you can come back in 5 minutes or something. Or if you're out of hospital, you can kind of just have everyone leave the room and reevaluate when you're ready to make your decision. Yeah. But that's sometimes a really good tool.
Yeah, it's a great tool. It really kind of breaks it down for you, so you can kind of take some time to like ask all the questions you need to ask. So yeah, really good stuff.
So yeah, and that's super helpful with like when you're trying to choose something, but how the heck do you refuse? What does refusal mean?
Yeah, that's definitely something we should definitely go over.
Yeah, for sure.
You want me to go over that?
I do want you to.
So how that would really apply is, for example, like, they're offering, like, not even offering, but they're, mentioning like doing an episiotomy or something like that. You have absolutely every right to refuse anything that they offer. Sometimes for them, it's just more of like they need to kind of cover their butt and go over like all their protocols. But you can, just because there is a protocol doesn't mean you have to do it. Right. You can absolutely refuse it. And sometimes just having that just what is helpful is just signing a paper or something, just saying signing a waiver saying that like I'm, informally refusing this, and you can put it in my chart. And that can be really helpful because again, they're, it's not always malicious. They're not always trying to cause harm, but sometimes they're just trying to like cover all their bases so they don't get in trouble. So yeah,
I see that a lot in the hospital with people who are wanting to labor in the water and then are hoping to have a water birth, like to give birth in the water. Yep. And most policies at hospitals are not really supportive of that. Usually it's not that they're frantic because it's always going to result in some terrible thing. They just on the rare event that they need to get in and have more access to supplies or just the space around you, like they do get a little nervous of that likelihood. And then therefore it becomes this policy of, well, if you're starting to feel pushy, then we need you to get out. And it's kind of in that refusal category of, you can say, I'll sign whatever you need me to sign. I'm like, I understand the risks from what I have assessed. Like I'm low risk and it's appropriate for me to be in the tub. I feel comfortable here. I'm happy to get out if that changes. And you could even just say, put it in my chart, like you've explained everything to me, so that they feel like, all right, like we're documenting. She, all of it has been explained. She's, declining this at this time, and it kind of helps them to feel like they have checked off that box for,
exactly.
Covering their butts and stuff.
Yeah, absolutely. Yeah. I was gonna say something else about that. My brain just went blank.
That's all right. Yeah. It'll come back. It'll come back.
So it can be in any environment too. It doesn't always have to be hospital. It can definitely be like even at home with a certain a certain midwife or in a birth center. Anything comes up that you're not quite feeling right about, you would definitely say like, I'm not feeling that, and you can definitely decline it and sign whatever paper you need to sign.
Yeah, exactly. I think a lot of times we assume certain care is going to be kind of linked to certain birthplaces, but I've seen positive and negative experiences in all locations, and it's kind of a situation based. You could have a really decent and good provider who's trying their best, but maybe just did not do their best with you, and that's also something to think about. But I think knowing that you can consent or refuse to anything, and in any location, that should be unconditionally supported. There shouldn't be any like I told you so as if things change, or kind of like negative energy, or I guess like shame that someone is having on you for making whatever decision that you make. You should feel like your options are presented and then respected when you've made your decision.
Yeah, absolutely. And if that person is, giving you a hard time, you just kick them out.
Right.
You get out of here.
Yeah. I mean, if you're working in an out of hospital setting, you might have already really handpicked someone that matches. In a hospital, it's not always within your power to say exactly which provider's on at that time, but most of the time the provider that's on is not the only one in the hospital. So if you do need a second opinion or would like to talk to somebody else, or even just with nurses, you can always ask for a new nurse. They get that all the time. And it's not always that you're trying to be malicious either. It could just be this nurse is super sweet and that's actually irritating to you, or you do need someone who's sweeter and the other nurse that you had is just a little bit more direct and like more of a spitfire. Like it's okay to have that as part of how you're feeling safe with the decisions that you're making too.
Yeah, and that's really the ultimate thing, is to feel safe and not feeling like you're being pushed into anything. And having a doula can certainly help you navigate that for sure. Yeah.
Right, and it's just having informed consent, just as you're free to choose what happens to you, your body. Obviously, birth is wild and unpredictable sometimes, but you have to go with it sometimes. But you have that full ownership of your body and what happens to it. So you deserve all the explanations, all of the unconditional support, like we talked about. People having that narration of care piece too, where they're describing, like if you have consented to something, like as they're setting whatever it is up, or as they're approaching that time frame, being able to like feel like what's going on around you is kind of part of that informed choice or decision making.
Yeah, definitely. Yeah.
And I know you had a good tool too that you wanted to talk about.
Yeah.
And I'd love to hear more about that because I have questions.
Okay, awesome. The 6 steps of healing. This actually originally came from Susan Weed. She is a very, she's like one of the grandmothers of herbalism. So she has this whole, steps to making choices for yourself. And it's definitely more intuition based. So it's really like getting, diving deep into your own intuition and trusting yourself. And so, we're going to get into that right now. It's basically, figuring out your why and also what you'll do with that information. So these steps really kind of help you get to that why. And, it's again, just like really it's like the B.R.A.I.N acronym on steroids a little bit, because you're like really digging deep into your own choices and, decisions you want to make.
It sounds like B.R.A.I.N acronym is like, you kind of need to make a decision relatively soon. And I think it's, from what I understand, your tool is like a good, when you can marinate a little bit longer, or when it's a bigger decision that you're like leading up to.
Yeah,
it seems like you could definitely use it in a quicker way, but I think I think that's the one where you can dedicate more time to that. To that process.
Yeah. And it's really what it's about is like making, working through the smaller choices before you're making your big choice. So that's really what this is for. And when healing shows up, or any decision we need to make, we definitely, it's defined by something that we need to make a change around. So this is like really helpful in that. So step 0 is do nothing. Just sleep, meditate, unplug from everything. Like, don't talk to anybody. Shut yourself in a dark room if you want.
That's not my strong suit.
Me neither.
I'm like, do nothing. Like, to manage my anxiety about decision making, I'm like, gotta get into it. But I think that could resonate.
Yeah, definitely. And it sounds like just like, kind of relieving to me. Like, someone's telling me to do nothing. Like, okay.
I kind of like that.
I do. And it's hard to kind of sit with your own thoughts. And that's like why this step is like really the most important step, and the first one that you should always really start with, because you can get all sorts of information, like through, if you're a spiritual person, like through prayer, or just like, not even prayer, but again, just like sitting with yourself and like having downloads, they call it, like come in, like your intuition can really kind of peak up. Of course, for me, it's hard sometimes because my brain kind of goes crazy sometimes. And like, that's, I think a lot of people struggle with this. Just like sitting in that nothing can be very difficult, because you get all these thoughts and things coming in that aren't necessarily your voice talking. It's like somebody else maybe is talking. So this is kind of a great time to kind of evaluate that and say, is this merely me talking to myself? Probably not.
Yeah.
And just kind of like reassessing that. So it's really just getting quiet and just assessing the situation and what's really, again, not making any decisions, just sitting in it. And as simple as that, really.
That could be really effective just on its own. Like, that's pretty cool.
Yeah, exactly. And like I said, it's just hard to just sit and do nothing, but it's super beneficial. So any questions about step 0?
No, I like that step. Okay. I think, my gut reaction is, do nothing, sit with myself and my thoughts. But I think, honestly, it's probably something I know I need the reminder to still kind of tap into, like, okay, immediately, like, where am I feeling that? How am I feeling that? And also what's coming to my mind.
Yeah,
so
exactly.
I think that's good.
Yep. Yeah. And then just tuning into your body, honestly, like, where are you feeling things in your body, and just like bringing breath to those areas, and just kind of just trying to relax, try and clear your head a little bit as much as you can anyway.
Great.
Yeah. So step 1 is collect information. It's like low tech stuff like reference books, support groups, or divination. If you're into like tarot reading or oracle cards, that's kind of like you're starting to investigate a little bit. You're like dipping your toes into, possibly finding out like where can I find information, and who has it, really, like who might be able to help me. Start thinking about who you want to get your information from, and also information within yourself is really important. Again, this is kind of like that instead of doing nothing and just thinking about nothing, nothing, this is where you start to like ask your intuition, like, what am I really thinking I should do? What's my gut telling me? Also like possibly, and like, this is literally taking the first step of like, okay, who can I talk to about this? Like, is there someone that I can talk to, or is there a support group I can go see, or what tarot deck do I want to choose to kind of like get some information from? So that's just like a little baby step. Like, this is just like starting to make some movement. So, yeah.
Okay. So step 0 and step 1, do you feel like that's like the base? And I guess, how do the steps work? Does you have to do step 0, 1, 2, 3? Like, is it very linear?
Yeah, no, it's not linear at all. So, yeah, you may find that like you just do step 0 and 1, and then you're like, oh, I have my answer. I know what I need to do. Usually step 2 is kind of like where you can get a little more information. We'll get into that in a minute. Okay. But so yeah, you don't have to like necessarily take these steps like exactly how they are. I do strongly encourage that people always start with step 0 and at least get there, and at least also step 1, just to, again, tune into yourself. Because, doing nothing doesn't mean do nothing at all ever. It allows you to create that space for yourself, so you can just kind of settle your nervous system and that sort of thing.
Arrive in the here and now, and
exactly. Get present. Yep, absolutely.
Yeah. Okay.
So.
Cool.
Yeah.
All right. Tell me about the step 2.
Yeah. So step 2 is engage the energy. So with prayer, homeopathic remedies, crying, visualizations, ritual, aromatherapy, color, laughter. So this is kind of when you're, starting to, there's like many things here, because homeopathic remedies are like one of my favorite things to talk about. So this is like starting to get the energy moving, basically, is what step 2 is. So if there's like a homeopathic remedy that might help, which they're very, very subtle, they work with like your chi or your vital force, your energy within yourself. They really help work with what is already available to you within yourself. So that's how homeopathic remedies work. So sometimes you can, take something that might help with whatever situation is presenting itself. If you need to cry because you're just overwhelmed and just like, or you're really happy, who knows, like whatever it may be coming up, if you need to cry or laugh, you can do those things just to get that energy and those emotions flowing and moving. Visualizations, that could be, if you're praying or meditating, imagining things that will help ease you, or, of course you don't want to go off the deep end and think about bad stuff, but you want to think about things that are going to kind of like help you just recollect yourself. So, and then ritual is anything like lighting a candle, again, more prayer, things like that, burning some incense or sage or something like that might help you. Talking to your baby or something like that. Those are all good things. Aromatherapy too, using essential oils. And then, color is more, I think, just like, adding color to your life, like get outside and look at the trees and just like get more visual, color senses going. So it's like just moving the energy is really what step 2 is about.
Okay.
Yeah. No questions about step 2?
No, I'm good.
It's still pretty self-explanatory.
I feel like it's like when you're trying to make a decision and you're trying to check in with yourself and then use the tools that you have.
Yeah.
Like, I think what you're needing will come to you, and you'll just follow what that is, because if you're the type of person who likes to meditate or pray, or just needs to bawl their eyes out because you whatever about the decision, I think it's good to just follow what tool you want to use, or tools.
Yep. Yeah. And this, like, again, these the first few steps are, I feel like pretty subtle, and they're just like, they kind of ease into each other, where it's not just like, this is step 1 and this is what you do, and then it jumps to like this other drastic thing. Like, these are just so gentle and subtle, the first like few steps. As we get on, they get a little more intense, obviously, but so
okay.
So step 3 is nourish and tonify. So herbal infusions, vinegars, some herbal tinctures. So these are just going to be like a little more like intense, therapies to use. Lifestyle changes, physical activities, and she actually lists moxibustion, which is compressed mugwort, and is actually known to really help with flipping breech babies, from what I've heard.
Yes,
so that's pretty cool.
Some of my clients have had success with that.
I have heard of that. I haven't tried it yet, but yeah, I've heard it's really successful. It also helps with like healing cesarean scars too, just a little side note. But yeah, so super effective things, but they, you know, also are a little more intense. So just depending, a lot of people jump to this step when they're presented with something like, okay, what herbal tincture can I take? You know, I'm trying to think of like if it's, you know, you're around 42 weeks and you want to get something going, like they'll, you know, do castor oil, they'll take castor oil or things like that. So those are like the more like, you know, you're given like what's going on, and then you jump to step 3, whereas like you're skipping the earlier on steps that may give you your answer. You don't have to jump to that. So step 3 is that just taking more action. So you just check in this step. You can check and see what feels good. You're not looking to cleanse or purify anything. You're just looking to nourish yourself with herbal remedies or food or something like that.
Sure.
So this is actually like, you know, doing some sort of action to really, you know, move whatever you need to move as far as like whatever is going on. So
yeah, okay.
Yeah. Any questions about that?
No, it sounds good.
Okay. Maybe our listeners might have questions, but
they can always
they can reach out for sure.
Yeah.
All right. So step 4 is stimulate and sedate. So hot and cold water, many other herbal tinctures. So herbal tinctures kind of play into this one too. Acupuncture, massage. There is a risk of developing a dependency on this step. So if we're like, you know, these aren't bad, of course. Like if you want to get acupuncture and do massage, these are also really great modalities. But some people like it's like searching outside of yourself for things to resolve whatever's going on. So overusing it can definitely cause a problem in the fact that it just can become an addiction, or, you know, you think, again, it's going to fix the problem rather than like really trying to maybe figure it out on your own. But again, these modalities are great to use still. I haven't, you know, I use them myself. So, you know, but I think it's important to follow the first few steps and just see if those things work before jumping to this one. So yeah, again, just baby steps.
Great.
Yeah. Any questions about that?
No, you did great.
All right, cool. All right. Yeah. All right. And so step 5 has 2 different, so it has a A and a B.
Okay.
So step 5 is by using supplements. So again, getting a little more intense with things. So vitamins, minerals, special foods, supplements are definitely a little more intense than like using your tinctures and food and things like that. There's always also a risk taking these things. They might have side effects, you know, that kind of thing. Again, like just trust your intuition. If you feel like something might really help you, then go with it, you know? So that's step 5A. Do you have any questions about that one?
No, that sounds good.
Yeah. Okay. Again, these are pretty self-explanatory, but, and then step 5B is using drugs. So a little more intense. So like, you know, oral injectable things, high dilution homeopathics can be considered in this, step 5B. So yeah, it can definitely, you know, be a little bit more, intense if you use homeopathics that are higher, dilution or something like that, or lower dilution, I should say. An overdose can happen. So we want to be careful of that. If someone's guiding you through this, that's always helpful, you know? Any questions about that?
Nope.
Okay. And then step 6 is breaking and entering, which is what Susan Weed likes to call it. So this is like fear-inspiring language. So it's like we have to do surgery, colonics, psychoactive drugs, diagnostic tests, biopsies. You know, side effects are obviously inevitable. There usually always are side effects to this. Also, you know, drugs too. And can include permanent injury. People might get a little scared of this, but permanent injury or death. So we want to be really careful about this last decision. Yeah, this last step, I should say.
Okay. So I really liked the first couple of steps.
Yeah.
And then I feel like when you have a really challenging decision or you've got a lot of time, then you can add on the other steps. But you can skip around, right?
Yeah, I would think so. I mean, I would probably, again, it's
Start
really,
with 0 and 1,
Yeah.
and then see if you need 2 or 3. You could skip 2, go to 3. I feel like our listeners would probably really appreciate the check-in with intuition, the talking to baby type of things, the
Yeah.
getting into your element of like, where do you feel safe and who can you talk to safely? I feel like those are such good skills to just tap into, not only for decision making, but just parenting in general, or just life in general.
Yeah,
you know?
totally. I mean, I use this for many different things. It's helped me really slow down. And that's exactly what it does. It just helps you really slow down and take baby steps.
Yeah.
And, you know, towards the end, it does jump to some, you know, kind of, I wouldn't say extreme. Well, maybe the last one is extreme, but yeah, I mean, it's not to, like, you don't have to avoid step 6 or step 5, but of course, if there's an emergency, you might have to resort to that. Like, it really, again, I can't stress it enough, and I know you can't stress it enough. It's just really trusting yourself and doing what you feel is really right for you and for your baby. So,
Right.
yeah.
Right. That's a really great tool too to keep in mind.
Yeah, definitely. So, yeah, that's
Great.
it. Those are all the steps.
Fantastic.
Yeah.
So you've come away with a few different tools.
Yeah,
And
definitely.
I think there's multiple tools within her 6 stages of healing.
Yeah.
Cool.
Do we want to talk about at all, like some examples?
Yes.
I think that might be helpful, I think.
So like the water birth, you know, that's an example, like in a hospital. It's really just like keeping in mind like policies, not law. But I think, for example, like newborn meds, like a lot of times in certain places they're kind of standard, or in society it feels standard, or even something like circumcision. Like there are some really, like they're hot topics, so we won't get into like all of that, but it's your choice. You have every right to look into your intuition about it, how the risks and the benefits are weighed for you, like what matters more to you, thinking about like what your values are and like how the decision might align with that. If you did want to do a certain like medication, like then the choice of like you can have baby on you while those are happening, like all of that is good to kind of know. But you can say yes or no to things, and you know they should respect that.
Yeah.
But yeah, like even in a cesarean birth situation in the OR, everyone kind of assumes, well, my hands are gonna be tied down, I'm not gonna be able to see baby for a while, like all that stuff. In most cases, they're being pretty proactive with a cesarean. They're not often waiting and pushing and waiting, and then all of a sudden it's emergent. Yes, it does happen, and obviously then you're like, we need to keep everybody alive and well. But most of the time, like we like to go beyond just thinking about, are you alive and healthy, and so is your baby. Like you deserve to have kind of all the layers there of support and autonomy. But in the OR, you can do skin to skin with your baby. You can have your arms free as long as you're not reaching behind the sterile drape into the sterile area. Like your providers, if you think about it, like when you're laying on the table, your providers are right at your belly bump. Like they're right, that's where they are. So you could touch them, but don't do that, or otherwise they're busy. But you can have your arms free. You can hold your baby. You can do skin to skin. You can nurse in the OR. I was at a cesarean birth where it was very important to them that the partner did the official like cord cutting. Yes, most of the time they'll leave the cord long. You know, they'll clamp it. The placenta is not yet given. It's not yet birthed, and then the baby's brought to the warmer. The partner does like the last snip. But I was in the OR, and the placenta was birthed. The baby and the placenta were brought to the warmer, and the partner got to do the official trim. Like there's a lot of choices out there, and I think part of it is it's hard to know what the choices are, what the options are.
Yeah.
But asking good questions can help.
Yep. Definitely. Yeah.
So was there an example that you wanted to share?
Yeah. So what I commonly have seen is the topic of gestational diabetes. So I feel like this is like a big one.
Yeah.
And there's lots to talk about here, but we're not going to get in too much detail. But just like that, there are other options that if you don't want to do, you know, that sugary drink, the glucola drink, there's options like some midwives will suggest like doing a, you know, handful or something of jelly beans. That's another option if you like sugar. If you generally like eat healthy and don't, generally eat sugary things. You can certainly do your own at-home test with a glucometer. Even with the jelly beans, you can do your own test with like a glucometer and just test an hour after you eat, or eat the jelly beans. So really, there's definitely like other options besides that if you don't want to go with the sugary drink, because it can be a bit intense for some people drinking like this giant thing of sugar. So yeah. And then the other example I think that would be good is that to go over is like out of hospital birth, because there are still things that are brought up, like you know, vaginal checks, and if that's something you definitely didn't want to do, you can still say no to those at that time. For the most part, hospitals and out of hospital midwives and that sort of thing, they definitely ask you still. So just really being like diligent about trying to pay attention to what they're offering, and if don't feel like pressured into anything, and just making sure they do give you your options, and if there are alternatives to whatever it is, I think it's really important. So we should also probably talk about like the role of the doula and the partner and like helping with those things too.
I feel like I get a lot like how do I advocate for myself? How do I ask the questions? Like you are usually in a very non-logical brain during labor. Usually you're in the moment, like maybe during pregnancy or postpartum, you could have the opportunity to have the conversations and kind of stay in that logical space. But in the labor situations that you might be in, you might not be able to step into that analytical brain as easily because we're so instinctual. We go really deep and inwards. So it's good to like set up the parameters with your partner, with your doula, if there's anybody else that you have supporting you in the space, to be able to say, you know what, in the event that I'm maybe not able to like ask all the questions, can you make sure to go through the B.R.A.I.N acronym with everybody? And I'll still be listening, but I might not be able to ask the questions. Like have your team be able to kind of help with promoting the conversation around the choices and alternatives, and kind of talking out what that decision then might mean, because they're like that one step removed from obviously like where you're at. So utilizing doulas, we try to be really great with very non-frictiony kinds of questions. We try to be good with communication tools, because some providers, if it's not the pregnant person asking the question, sometimes they wonder if there's like an alternative agenda that's being pushed or something, and so they wonder like, are you asking that for you or for like the birthing person? And I feel like as a doula, I often will say, she's shared with me, this is really important to her. Do you know if there are any alternatives to like what you're suggesting that might really work for her? The doula should be able to come to the table with questions and be able to ask it in a way that's not going to just blow the room up, but to be able to help promote really helpful and easy conversation about what is on the table. The other thing I did want to mention too is like showing just like appreciation. Like, so if a provider or a nurse is or a midwife is offering something in particular that you're not necessarily agreeing with, but and your doula can do this for you too, and your partner can do that for you too, and just saying like, thank you so much for that information, but are there alternatives? Again, like, and it helps with that relationship of nurturing. Like you're not there, no one's really wanting a bad outcome or a bad relationship, so it's like, even if you're like, oh, I don't know about that, when you're delivering that news, like, yes, they should be receiving that well, of course, but appreciating their understanding, if it's not something they would have recommended, or if it's really against the grain, like, thank you for understanding, even if it's kind of there, but they should do that for you. And a lot of times just saying no, like, people, I think, see not great like physical, like body reactions from their team. But if you're saying, oh yes, and I've still decided, like, yes, I understand, or yes, like the yes and statements is something that we talk about sometimes with trying to help them feel like you're wanting to work together on this birth experience, but it is ultimately it's your body, it's your baby, it's your choices. And again, things could come up that, or maybe the decision feels like it's been made for you, but you usually know that in you, like, I need to make this decision, even if it feels like the choices are pretty limited. But you deserve autonomy with your choices and your body, and to feel like you have everything laid out for you, and have that unconditional support and not being afraid to say no if that's what you want.
Yeah, absolutely. Yeah. Because
I feel like,
go ahead.
I was going to say, a lot of times we talk about informed choice as in informed consent, but there is informed refusal. So I think that's why we're kind of bringing up some refusal scenarios too, because informed consent is just understanding everything that's involved and then feeling like you can confidently say, I understand what this decision means and I'm choosing it.
Yeah, absolutely. Yeah, because you just want, again, just to feel safe and like everybody has got your back and you're in a safe space, and just, you know, being kind and polite, and your doula being kind and polite, and everybody just, it's going to, you know, not create that tension in the room, which can really cause some problems. So, yeah.
If for some reason there was tension and you needed that from your partner, your doula, like tell them it's okay to go there. Obviously not start shit, but like, but like if for some reason there's some really, like I've seen in all settings, I've seen some like pressury kinds of things where the provider, I think, is just maybe in fear, or the nurse is just a little in fear. And so usually they can kind of seem more intense or more anxious.
Right.
Understanding what that means, like, why is that? Is that just because this is like outside of what they normally do, and so they're not so sure about that? Or are they really seeing some big factors that are really worrying for them?
Right.
So understand, like, I see that this is something that is kind of like stressful. Is there something I'm not understanding, or something you want to explain further? And then getting the information, and then and then being able to rely on your people if it seems like you're saying no and then they're not respecting it too. That's also a tricky situation, but we will talk about how to have like an autonomous hospital birth too, where a lot of this plays into it, but it's kind of applicable to all settings. But
yeah, absolutely. Yep.
Great.
Cool.
Yeah.
All right. Is there anything else we want to cover on this topic?
I think that's it. I think we did it.
Yeah. Well, if anybody has questions, definitely reach out to us. We would be happy to answer any like specific questions, or
for sure.
Yeah. If you're watching on YouTube, you can comment or, you know, just send us an email if you're listening. So we'd be happy to help out. So
we're here for you. Yeah.
Absolutely. Good. All right.
Thank you.
Yeah. So we hope you enjoyed this episode. I hope it, you know, helped you better understand what informed choice is. And if you have any questions, definitely reach out to us.
Sounds good.
But yeah, next week we're going to be talking about conscious conception. So it's a little bit more spiritual, and I love this topic too. So yeah. So thanks for listening, and
thank you.
Have a great day.
Enjoy your day.
Night, wherever you are.
Take
care. Bye.
That's it for this topic. Thanks for tuning in. Check out the show notes for any resources or links that we mentioned today. Make sure to subscribe and follow us on your preferred podcast platform, and also be sure to give us a review.
It really helps us grow and reach more people who could benefit from this info. Also, check us out on YouTube and visit our blog, where we have this podcast transcribed for you.
We'd love to connect over social media too, and we're just an email away if you have any questions, or if you want to request a topic to be covered.
We hope this helps your mind, body, and soul in having the supported and holistic journey you are so deserving of. Embrace the power within you.